My friend was about welcome to medical science classes. Student of medical science, I wanted to take together every mass of medical science. What do you think? Say, do that, for the as a Muslim, I'm the one who included this for all of my master now my friend was about yes, how much question? Ya alif lam lam ya Allah shafi ka mukti da ana abdul muhammad shafi maafi ka la ilaha illallah muhammadur rasul. Now my friend was about medical science, how without kidney patients are covered by medical science. In case of creator can do it. As a creation, I also can type for can make kidney, artificial kidney. But by medical physics, by medical chemistry, that is tough research without operation, like seeing the past. Say Allah Shafi Allah Mafi Allah Kafi Ana Abdul Muhammad Shafi Mafi Ka. For patient Allah Shafi Allah Mafi Allah Kafi. Try to make organ by the help of and take organ raw material. What is organ raw material? MSC. Then essential non-essential MSC. Then fluid, water, then distilled water, then hygienic distilled water, then hot meat, hot temperature, safe temperature water, vitamin, mineral, and glucose for self-fuel, oxygen. Wow. Now I find this out without kidney to kidney harvest. We know that dialysis necessary. Without now dialysis, by dialysis. If uric acid equal more or less 20, dialysis, without dialysis how you can survive? First restriction amino acid. You come to the certain amount of without kidney and kidney, due to kidney is not present. That amount, in that policy, how you survive? What is the work of kidney? Electrolyte balance, vitamin D3, fine, cholesterol. Then what is the work of kidney? Law of organ transplantation or law of any organ, hot organ, that what is the work of that organ? If that organ is cut down or not present, see the artificial suction. Electrolyte, if electrolyte, the kidney work, electrolyte imbalance, now balance, if two kidney is not present, electrolyte cut the electrolyte balance, then use hot vitamin D3, go to the waste, in case of sunlight, morning hour, and vitamin D3 in sunlight. If not go there, vitamin D3 artificial supplemental. Now if electrolyte balance, if sodium chloride, for example India sodium chloride, sodium is more important, gold standard, and salt, take the salt if heart have not suffered the heart disease. Now my friend was of water. Then electrolyte balance, vitamin D3 synthesis, and cholesterol. Then renin secretion. What is the renin one? Convert angiotensin 1 to 2. But renin is not secretion. If you give to the heart disease, suffer the heart disease also, do not present angiotensin receptor blocker. If you give to angiotensin converting enzyme blocker, that not work. But if you give angiotensin receptor blocker, the angiotensin is not convert, how receptor blocker work? That is the, if those are suffer kidney blocker, for them is angiotensin converting enzyme receptor converting enzyme blocker, angiotensin receptor work properly? No. Then give to, for them A, B, alpha blocker, beta blocker, calcium channel blocker, diuretic work, urinary waste product not, if kidney not present, diuretic also not work. Kidney stuck, if work there is a hamper or damage. Kidney not present, how to now kidney is not present, now how to complete that? If ureter present, pelvis of the ureter, there you connect the pelvis of the ureter to inferior vena cava, to connect the pelvis of the ureter to vein or artery. Oxygenated blood, deoxygenated blood, vein, artery, pelvis of the ureter, renal artery, renal vein. Connect. In renal vein, renal artery connect to the pelvis of the ureter. Gas supply and pelvis of the ureter, fine. Purify that and urine production. If pelvis of the ureter not present, that also not present, then transplant to other patient. If that not present, if not possible in that circumstance, then buried animal, pelvis of the ureter. If that not possible, what happens? Cut down the kidney, still now patient how? Then without kidney, what is the decision? What kidney work? If that supplementary, what will say? Then urine is not occur. If urine is not occur, what happens? Uric acid, waste product remain. Then by waste product, how you correct that? By dialysis. But without dialysis, how can we? What is the waste product hamper in case? What is the dangerous? Kidney level rise in case of sign of kidney disease. There is the other sign, symptom, sign. Now, in case of uric acid, you give the anti-uric acid. How you found the anti-uric acid? Take the patient uric acid, give to the buried animal, and found the anti-uric acid. When anti-uric acid present in the blood, uric acid breakdown. Now that take the uric acid, give the artificial culture media, where give the weak acid, weak alpha. In that artificial cell media, cell can survive, but uric acid, that weak acid or weak alkali, the uric acid is not work properly or break. Just break down the uric acid. We need that kind of solution or that kind of blood. If you find that, keep that. Still now researchable. Fine. That is the without kidney, how patients survive. Policy. Tough. Now everybody understand that. Then when kidney come, kidney transplant occur. If kidney transplant, kidney not present, then buried animal kidney connect. If pelvis of the ureter not present, that also not present, then connect to the pelvis of the ureter, kidney transplant. Otherwise, you pelvis of the collect the pelvis of the ureter from buried animal, connect to the artery, renal artery, renal artery. Pelvis of the ureter, renal artery, renal vein. What is the reason? No circulation. Oxygen circulation. You connect that renal artery, renal vein. Pelvis of the ureter, renal artery, renal vein connect. From the animal. But in atomic kidney, how in case of atomic